Nimbulavinaka. I'm Dr. Chone Hawea. I thank everyone who have actively participated in our Talanoa. Thank you for your debates. Thank you for opposing views. Without those views, this Talanoa would not allow us to find solutions forward. And so, minagabakalevu for your participation. Today I'm going to talk about the Delta variant of COVID-19 virus. And I'm going to discuss an important aspect of the preventative health measures that were implemented against the Delta variant from the start, and then link it with the use of our Constitution, the 2013 Constitution, and and how it also links to the no jab, no job, and also how it links to the recent national budget announced several days ago. So people may ask, why are you discussing the law? Why don't you leave it to the lawyers? Especially trying to discuss a health issue with regards to the Constitution. Well, as a citizen of Fiji, that is, as an active citizen of Fiji, it is my duty, first of all, it is my duty and my responsibility to learn, to know, and understand the Constitution and all other laws that we have in Fiji. That makes me an active citizen, because if I am not aware of the law, then I am at risk of doing things that are against the law or supporting activities that are against the law. So that is my first duty as an active citizen. Secondly, being a medical doctor, the medical ethics has a pillar that says justice. So there is autonomy, there is doing no harm, maximum benefits, and justice. And in order for me to practice fully according to the pillars of medical ethics, I need to understand the law. Then I will understand where injustice has happened. Because where injustice has happened, then it is unethical. So the law affects my practice and understanding of the law. So I need to know how the law is applied to my practice. And that's why I am going to discuss it as such, and I've been discussing it as such. So I am going to zoom into the part of the Constitution that that is of utmost interest right now. So it's under the chapter on the Bill of Rights, and under the section of right to life of the 2013 Constitution. If you look at the section on right to life in the 2013 Constitution, you will see that there is a part there that says the High Court can order that your individual right or my individual right to life can be forfeited on certain cases, on certain occasions. And there are a list of occasions, of criteria that must be satisfied in order for this part of the law, for the forfeiting of your individual right to life can be satisfied. So it can be applied only on certain criteria, and the criteria that is specific to health and specific to this pandemic is this: that your individual right can be forfeited if it prevents the spread of an infectious disease. If it prevents the spread of an infectious disease. If whatever is being ordered prevents the spread of an infectious disease, then your individual right on those occasions can be forfeited for the sake of the rest of the population at large. So how is it being applied currently? So for example, the order that we mask up, the order that we have this 2-meter distancing, social distancing, the isolation, the quarantine procedures. Now these are described under the Quarantine Act and the Public Health Act. But in order for the health professionals to carry out their job, and these have been proven to prevent the spread of infectious disease globally. It is a known, these are known preventative health procedures or protocols. And if in Fiji, if certain individuals say, no, I don't want to be quarantined, I have the right to go to work and earn money, because that's right to life, then the health professionals can ask for a court order, and the court order can then take away that right that I'm saying that I have, and forfeit that right, because my movement will spread the disease. So by restricting me to a quarantine facility or to an isolation place will prevent the spread of disease. So in that sense, all these public health procedures that are being implemented help prevent the spread of disease, and so they are justified both in the Public Health Act, in the Quarantine Act, and it is covered under the Constitution should people do not want to follow health professional directives, especially in a pandemic such as this. So that was implemented last year and this year as well, and we all know what that is. Most of us, if not all, have been compliant. There are people who have been non-compliant, and the law has been applied on them. Some, the curfew, people breaking the curfew, and non-compliant with quarantine procedures, isolation procedures, the lockdown measures. Now, the lockdowns, we all know that there has been a lot of issues surrounding the lockdowns. Why did we open the borders? Because then that will, spread the infectious disease. And so in that way, it is, contradicting. On one side, we are social distancing, masking up, and social isolation and quarantine. But then on the other, we are opening the borders locally, so we are trying to apply the public health and preventative measures on one side, and then on the other, the government is issuing this opening of borders and people are moving. So there's contradiction here, and there hasn't been much opportunity to have a constructive debate around this. But such is the procedures, and these are described clearly in the Public Health Act and Quarantine Act, and also it's in the Constitution, the 2013 Constitution of this country, and that is there. So for those of us who think that when it comes to those preventative health measures, that our individual right is above, we are wrong. These measures have been proven scientifically for decades to prevent the spread of infectious disease, and that's why they have made it into law, and that's why it's in the 2013 Constitution. So all those procedures are according to the law and right when we consider the Constitution. Now, vaccination is another preventative health intervention. The only difference is it is an invasive procedure, meaning it's a procedure whereby something foreign is going to be forced into my body. In this case, it's a foreign chemical, it's man-made chemicals. And so that's an invasion into my body, and especially so in this case, the vaccine is an untested vaccine. The trial is ongoing right now as the vaccination program is being implemented. We are the human subjects, and this has been legalized in the United States. For those of you who may not know, in 2016, the US Congress passed a law called the 21st Century Cures Act, and under that law, the pharmaceutical industry are given a mandate to roll out an untested medicine. In this case, it's a vaccine. So they are given the okay to roll out an untested medicine if there is a mandated emergency need. So when the World Health Organization announced that COVID-19 is a public health emergency of international concern, that gave the mandate for the emergency need of a medicine that will prevent future infections and thereby allowing the control of COVID-19. So WHO gave the mandate, and the US Congress through the 21st Century Cures Act gave the platform now for the pharmaceutical industry to come up with a solution. And so the pharmaceutical industry came up with the vaccines. And according to law, they can now roll out the vaccines without going through the scientific testing process applied to all other new medicines. And it has to go through animal trials and multiple levels of animals to monkeys, who are supposedly closest to humans, and then human trials. When there are really good results with animal trials, then the first human trials happen, and there's randomized control trials. It's double blinded, and so it's very scientific. The data that is collected is scientific, by scientifically trained people in a scientifically controlled environment. So the design and methods used ensures that there are no ethical issues first. There are no ethical issues. Then the design and the scientific content is not influenced. The outcome should not be influenced by any external self-interests. So, even in the publication of the results of these kind of trials and testing should not be influenced even by the makers of medicines. So it is supposed to be like that, and it is quite time consuming and quite costly for the pharmaceutical industry. And so that's why there was a need to have a law to ensure that if an emergency like this happened and it's an infectious disease that is posing a fatal threat to a large number of the population, a large proportion of the population, then it justifies. So the law is there to justify the rolling out of a vaccine. So there we have it. There we have the background as to how it is that vaccination has been mandated. But the rolling out of the vaccine will still need to be carried out with scientific observation. And the only scientific observation that was approved according to the same law, the 21st Century Cures Act, is real-world data and real-world evidence. What that means is, for example, in Fiji, if we are giving the vaccination, we should be monitoring the side effects, or the good effects, the side effects, and if there are any deaths that are related. And if there are, if somebody has a jab and then they die later, that is supposed to be investigated. But before they have a jab, they should have all the tests to prove that this is my state of health now, so that if something happens to me in the future, it cannot be blamed on anyone else but the vaccine. Or if I have diabetes and my kidney is already not good and not functioning properly, and then I receive the vaccine, and a little while later I succumb, and then and then I have a severe complication. And then when we measure the kidney function, and then we realize no, this is just because of my diabetes and my kidney problems. It has nothing to do with a vaccine. So that data collection is supposed to be happening while the vaccination is being rolled out, and that's called real world data and real world evidence. So all the countries that are rolling out vaccination are supposed to collect their own data, and that was the condition that came with the approval to roll out an untested vaccine with a US 21st Century Cures Act. Now coming back to us in Fiji. Earlier this year, our life was almost going to normal, except for curfews that were at 11 o'clock. We were almost just going back to normal. And then the Delta variant came into the country. Now, before the Delta variant came into the country, everybody was aware because of the international media and social media. Everyone in the world knew about the havoc that was happening in India because of the Delta variant. And so preventative health strategies all over the world, including Fiji, will put India as a very high risk port destination or port of exit. And so everyone that would be traveling out of India is very high risk, irrespective of their testing status. You are coming from a country that is being wreaked with havoc because of a Delta variant of the COVID-19 virus, you are a high risk. And so the public health surveillance system in Fiji would be on red alert, high alert mode. The quarantine procedures and protocols would be ready, and any movement of any passenger from India to our country will be strictly monitored. And so we know that 2 of our citizens travel from India. We know that. And they are citizens of this country. And so they are returning from India and entering into our country. Because they are coming from India, and everybody knows that India has the Delta variant of COVID-19. It's causing a huge crisis. They should have been barred from entering the country. These 2 individuals. They should have been barred by the health authorities, by the government health authorities. Why were they allowed to enter the country? I'm asking that question because if, first of all, immigration will be alerted that there is a request to enter the country from India. When these 2 are still in India, an email could easily be sent to them and inform them that because of the current situation in India, you are hereby directed to remain there. The government will support your stay in India and ensure that you are comfortable and healthy, and we will assist in whatever way we can to look after you while you are in India. If that didn't happen and they are already on board the plane, and the plane is going to come to, say, Hong Kong, and then Hong Kong to Fiji, once it reaches Hong Kong, a public health message could stop them at Hong Kong, ask them to return back to India, pay their fare back to India, and compensate them for the stay in India. If the plane has already left Hong Kong and it has arrived at the Nandi International Airport, we can tell the plane to return and take them back. And the same clause in the Constitution allows for that. So we can access the High Court, ask them to give an order to tell this plane to go back. And the question will be, but these are our citizens. These two individuals are citizens. Then that's where the clause is necessary. Your right to life, to live in Fiji and a life in Fiji as individuals is now being forfeited for the sake of the nation. It does not mean we are just going to chase you away. We will ensure that we take care of your way back to Hong Kong, to India, and we will look after you while you are in India. That was available to the health authority and to the government. To individual citizens, their right to life can be forfeited to prevent the spread of the infectious Delta variant of COVID-19 virus to spread into Fiji and infect and cause the crisis that it has caused. So the government did not utilize the available resources in terms of law to prevent the spread of the Delta variant of COVID-19 virus into Fiji when they had it all along. And they've been implementing according to that clause. That is negligence. That is gross negligence. Gross malpractice in terms of preventative health practice. And the government has to answer for that negligence. Because of that negligence, the country is suffering. Many families and extended families are mourning the death of their loved ones. People have lost employment. Businesses have shut down. People are going to be unemployed very soon. Now here's the interesting part. They did not utilize that clause in the Constitution to intervene at the border with two citizens. So they valued two citizens over the entire country and its citizens. They did a weighing of the two, and according to government, will uphold the rights of these two citizens and forfeit the right to life of the whole of Fiji. That is gross negligence. And the government has to answer for that. This is the funny part. It's not funny, actually. They did not utilize that law there. They did not utilize that part of the Constitution. And yet, they allowed for the Delta variant through that negligent practice, decision making. The Delta variant of the COVID-19 virus entered the country, created havoc, and then they started their damage control. And for that, people have to suffer. But then, they opened the borders again. Another unethical move. Open the borders and then blame the people for spreading the infection. The very procedure that we use to prevent the spread they break it themselves. But they do not only do that, but they go ahead and blame people for non-compliance. It's not non-compliance, it's gross negligence on the government's part. And they must answer for it. They are accountable to the people. It's a government of the people. And so, therefore, they are answerable for that gross negligence. The no jab, no job policy has been brought into effect because of the negligence. The government must take that responsibility of the gross negligence that they did from the start. Malpractice in preventative health. The Constitution was available, but then they decided to use the clause for the no jab, no job by saying your individual rights as citizens of this country will be forfeited for the rest of the population. Now, vaccination does not prevent the spread of COVID-19. Vaccination, being vaccinated does not prevent you from spreading. You can still have an infection, you can still be infectious, therefore you can still spread. So not only have they become unconstitutional, but all of a sudden they decided to utilize what has been there all along, and they could have done that to prevent the crisis that they have created by their gross negligence. Just too many unethical moves, too many unethical practice, and the people are being punished for that. And now, when people are suffering, people are stressed out, trying to figure out financial commitments, putting food on the table. How am I going to pay for the bills? If the school starts, where am I going to get the money from? That's stressful. And so that makes me vulnerable to manipulation with money. Then the budget comes out and we are incentivizing with money for what? For vaccination. Totally one unethical practice after another. And all these are consequences of the negligence that happened at the border when we gave priority, importance was given to these two individuals over the entire nation. Two individuals were valued more than the entire nation. The entire nation is suffering because of this gross negligence, malpractice, unethical preventative health practice. And those who are in the position of authority will have to answer for that. The Honorable Minister for Health, the Honorable Prime Minister, and the Honorable Attorney General. You are the decision makers from the border. You have to be, Honorable Sirs, Honorable Gentlemen, you have to answer to the nation. The Delta variant could have been returned to India on that flight, or could have been disallowed from leaving India to prevent the spread of this infectious variant, the Delta variant of the COVID-19 virus. I hope you understand, people of this country. I hope you now understand the Constitution and how important it is for us to know, as citizens of this country. We cannot call ourselves active citizens of this beloved country if we are not aware of the law, especially the Constitution. We have to know so that we recognize when there are moves that are unconstitutional, and for us as doctors and health professionals, we have to recognize when unconstitutional practice has happened, and we have to stand by our justice part of our medical ethics. The Delta variant could highly have been contained in India and never allowed to spread into our country. It has created so much suffering, and the government is accountable to the people to give answers. Vinaka.